Chapter 49, Sensory Alterations. People learn about the environment from 5 senses: sight, hearing, smell, taste, and touch. Human beings rely on a variety of sensory stimuli to give meaning and order to events occurring in their environment. When sensory function is altered, a person's ability to relate to and function within the environment changes drastically. As a nurse, you meet the needs of patients with existing sensory alterations and recognize patients most at risk for developing sensory problems. You also help patients who have partial or complete loss of a major sense to find alternate ways to function safely within their environment. Here's some terminology that you'll want to be familiar with. You likely all know that the adjective sight is the visual sense, but be sure you also know other descriptors of the senses. The kinesthetic sense enables a person to be aware of the position of body parts and movement without seeing them. The ability to speak is not a sense, but it is similar in that some patients lose the ability to interact meaningfully with other human beings if their ability to speak is compromised. Sensory reception involves the stimulation of sensory nerve fibers and the transmission of impulses to higher centers within the brain. The nervous system is continually bombarded with thousands of bits of information for the sensory organs. After interpreting the significance of stimuli, the person reacts to the most meaningful ones. A healthy balance between sensory stimuli entering the brain and those that reach a person's conscious awareness maintains a person's well-being. Sensory alterations. When sensory function is impaired, the sense of self is impaired, and this affects one's ability to socialize. Normal sensations consist of reception, perception, and reaction. Box 49-1 on page 1235 presents common sensory deficits related to sight, hearing, balance, taste, and the neurological system. Be sure that you look at that. 3 types of sensory deprivation occur: reduced sensory input from sight or hearing, deprivation resulting from exposure to strange environments, and deprivation resulting from confinement in restrictive environments, such as bed rest, because this produces monotony or boredom. Box 49-2 presents the effects of sensory deprivation on the cognitive, affective, and perceptual well-being of patients. Excessive stimuli prevent the brain from responding to or ignoring certain stimuli. Overload prevents meaningful response by the brain. A person's tolerance to sensory overload can vary according to fatigue, attitude, and physical and emotional well-being. A hospitalized patient or an acutely ill patient can easily become a victim of sensory overload. It is easy to confuse behavioral changes associated with sensory overload with mood swings or simple disorientation. Factors affecting sensory function. Infants and children are at risk for visual and hearing impairment because of a number of genetic, prenatal, and postnatal conditions. Visual changes occur during adulthood that result in the need for glasses, often around the age 40 to 50. Glaucoma, reduced visual fields, increasing glare sensitivity, impaired night vision, reduced depth perception, and color discrimination can all occur. Aging results in a gradual decline of acuity in all the senses. Patients who are older, immobilized, or confined in isolated environments are at risk for sensory alterations. Proprioceptive changes common after age 60 include increased difficulty with balance, spatial orientation, and coordination. Hearing loss usually begins around the age of 30. Smell and taste changes begin around 50. Meaningful stimuli include those activities and people who have a positive influence on the patient, such as pets, music, TV, family, clock, and the calendar. A disruptive roommate or too many visitors or too much light or noise in the room can negatively affect the patient. It's ideal for the nurse to perform activities such as monitoring vital signs and providing assessments, treatments, and medications at the same time so the patient can have adequate amounts of rest. Patients need their interactions also. Absence of loved ones or significant others and friends can increase incidences of isolation, loneliness, anxiety, and depression. Occupations and recreational or sports activities can have effects on sight, hearing, and body parts. Hospitalized patients in isolation with cast or in traction will be unable to move around their environment. Certain sensory alterations occur more commonly in selected ethnic groups. Look at page 1237. There are cultural aspects of care, disparities in sensory alteration. To apply critical thinking in the case of sensory alterations, integrate knowledge of the pathophysiology of sensory deficits, factors that affect sensory function, and therapeutic communication principles. Evidence-based standards of care and practice, such as those from the Academy of Ophthalmology and the American Speech Language Hearing Association, provide criteria for screening sensory problems and establishing standards for competent, safe, and effective care and practice. Previous experiences in caring for patients with sensory deficits enable the nurse to recognize limitations in function in each new patient and to understand how they affect the patient's ability to carry out daily activities. Assessment. When assessing patients, you need to identify whether any pathology exists. If the patient has a hearing impairment, you will need to adjust your voice. You need to assess how any sensory deficits affect the patient's psychosocial, developmental, and self-care abilities, as well as threaten the patient's safety. Some patients benefit from a referral to an audiologist or an otolaryngologist, sorry, that's a big word to say, if assessment reveals serious hearing problems. Assessment of a patient's health promotion habits reveals risk for sensory impairment, including age and living in a confined environment. The Hearing Handicap Inventory for the Elderly, or HHIE-S, effectively identifies in 5 minutes with 10 questions patients who need audiological intervention, and you can ask friends and family about any changes in behavior. Assessment of mental status is valuable when you suspect sensory deprivation or overload. To identify sensory deficits and their severity, use physical assessment techniques to assess vision, hearing, olfaction, taste, and the ability to discriminate light touch, temperature, pain, and position. Assessing patients' functional abilities in their home environment or healthcare setting, including the ability to perform feeding, dressing, grooming, and toileting. To assess health promotion habits, assess daily routines that the patient follows to maintain sensory function. Assessment of hazards in the environment requires the nurse to tour living areas in the home and look for conditions that increase the chance of injury, such as falls. To understand the nature of a communication problem, you need to know whether a patient has trouble speaking, understanding, naming, reading, or writing. Assess whether a patient lives alone, whether family or friends frequently visit. Assess the use of assistive devices such as hearing aid or glasses, and the sensory effects of their use for the patient. Assess the patient's medication history, which includes prescribed and over-the-counter medications and herbal products. Don't forget that some antibiotics are ototoxic. Temporary or permanent loss of the ability to speak, or aphasia, is extremely traumatic for an individual. Assess a patient's alternate communication method and note whether it causes anxiety. Global aphasia is the inability to understand language or to communicate orally. Nursing diagnoses. Some of these on the slide are potential nursing diagnoses that you would have for your patients with sensory alterations. The etiology or related factor of a nursing diagnosis is a condition that nursing can affect. The etiology needs to be accurate, otherwise nursing therapies are ineffective. The plan of care for patients with sensory alterations needs to include participation by family members. The extent of support from family members and significant others influences the quality of sensory experiences. An example of using a standard for planning is for patients who have visual deficits and are hospitalized. They are often placed on a fall prevention protocol that incorporates research-based precautions to ensure patient safety. Valuing intraprofessional and interprofessional collaboration is an essential nursing competency and plays a role in quality patient care. Page 1243 gives you critical thinking model for sensory alteration planning and nursing care plan risks for injury on page 1244. Implementation. The most effective interventions enable a patient with sensory alterations to function safely with existing deficits and continue a normal lifestyle. Preventing blindness is a worldwide health issue that begins with children and requires appropriate screening. The most common visual problem is a refractive error such as nearsightedness. The nurse's role is one of detection, education, and referral. Because aging is associated with degenerative changes in the ear, patients need to have hearing screenings at least every decade through age 50 and every 3 years after. Children and adults are vulnerable to eye injuries. Reinforce proper lens care in any health maintenance discussion. Older adults are often reluctant to use hearing aids. Acknowledging a need to improve hearing is the person's first step. Excessive cerumen occluding the ear canal causes conductive hearing loss. And when promoting meaningful stimuli, it'll be important to take into consideration the environment. You want to take measures to improve lighting, hearing, and tactile taste and smell sensations. If a patient is overly sensitive to tactile stimuli, minimize irritating stimuli. In creating a safe environment, adaptations will be needed for those with visual loss and reduced hearing, olfaction, or tactile sensation. The ability to speak with people allows patients to interact with others. When sensory alterations don't allow a patient to communicate, feelings of loneliness or decreased self-esteem can occur. Patients with sensory deficits often develop alternate ways of communicating that rely on other senses. For example, a patient with artificial airways are able to communicate effectively with communication boards, laptops, and with written messages. In the acute care environment, think how you would feel if you had alterations in hearing and vision. The patient with recent sensory impairment requires a complete orientation to the immediate environment. It's important to keep all objects in the same position and place. The most common language disorder for stroke is aphasia. Patients need time for rest and freedom from stress caused by frequent monitoring and repeated tests. To prevent sensory overload, control stimuli and orient the patient to the environment. It's wise to note on the intercom system at the nurse's station and in the medical record that the patient is blind or deaf. Patients with reduced tactile sensation risk injury when their conditions confine them to bed because they're unable to sense pressure on bony prominences or the need to change position. The patient with recent visual impairment often requires help with walking. A sighted guide gives confidence to patients with visual impairments and ensures safe mobility. Many of the interventions applicable to health promotion, such as adapting the home environment, are useful after a patient leaves an acute care setting. Patients who have experienced a recent sensory loss need to understand how to adapt so their living environments are safe and appropriately stimulating. When sensory alterations hinder interactions, a person feels ineffective and loses self-esteem. When we promote self-care, the patient's self-esteem will be bolstered. For example, patients with decreased vision can still feed themselves if the nurse places food on a plate according to the face of a clock. Also, the use of incandescent lighting and shades will help reduce glare. A sensory impairment has a significant influence on body image, and it's important for the patient to feel well-groomed and attractive. The use of Velcro slippers or pull-over shirts and elasticized waists will make dressing easier. For patients with balance and strength issues, safety bars in the bathroom can be helpful, as can placing non-skid surfaces on the floor. Location of food using the clock as a frame of reference is demonstrated here. To help with meals, arrange the food on the plate and the condiment, salad, or drinks according to numbers on the face of a clock. It's easy for the patient to become oriented to these items after the nurse or family member explains the locations. Can you read all three sections? Just as some of you can be able to read the text in all sections and some of you may not, I had to ask whether you could read them. Thus, it is the patient who can tell you whether sensory ability has improved. Collaborate with family members to determine whether the patient's ability to function within the home has improved. Working closely with the patient and family enables you to redefine expectations that can be realistically met within the limits of the patient's condition and therapies.